Good morning, everyone. My name is Heather, and I'm one of the nurse educators here. And this morning, I'm going to be reviewing Meleis' transition theory and how it applies to our example patient, Patty. Meleis' theory of transition focuses on an individual's response to change, supporting an individual through the transition and promoting optimal health. This includes both physical, emotional, and within the context of culture and society. Her theory suggests that people are more vulnerable to health risks during transitions, and nurses need to consider a client's level of comfort and mastery in dealing with these changes and differences to provide adequate and appropriate care for them. There are 3 components regarding transitions in her theory. They include the types, patterns, and properties. There are 4 different types of transitions in this theory, including developmental, situational, health and illness, and organizational. In Patty's scenario, she has several transitions that are occurring. The first one she's experiencing is developmental due to her aging. She's getting older, she lives alone, does not drive, and does not want to be a burden to her family. The situational transition she is experiencing is from her husband of 45 years passing away a year ago. After that length of time, this is a drastic change in what was her norm, and the change has been difficult. She also has a health and illness transition that's occurring with her leg wound that's not healing, that she's likely got peripheral arterial disease given her ankle brachial index of 0.7. And she recently started on hemodialysis 3 times a week after she transitioned from stage 5 chronic kidney disease to end-stage renal disease. The next aspect of the transition looks at the patterns, and are they single or are they multiple? Are they occurring at the same time or sequentially? And are they related or unrelated? In Patty's case, she is experiencing multiple types of transitions, and she's also experiencing them simultaneously. The next part looks at the properties of the transition experience. The first property that's applicable to Patty is awareness. She knows that she's grieving the loss of her husband, but does not see how her depression and anxiety are playing a role in her maintaining her health and being an active participant and being an advocate in her own health. This leads to engagement, which is how a person is involved in the transition process. Awareness can influence how much a person engages in the transition, and Patty's not actively engaged in her different transitions that are occurring. Next is the changes and differences. It looks at how people deal with the transition. Do the changes scare them? It's important to consider their comfort level in this process as well. If they're uncomfortable with the changes and differences, then they're likely to be resistant to the transition. Patty has seen a change in her identity in that she's no longer a wife and that her relationship with her husband is forever changed with his passing. Her health has changed greatly, and now that she needs dialysis and her diet needs to be adjusted appropriately, and that her leg wound is not healing, and she doesn't want to be a bother to her children. Thus, these issues are not being addressed. Another property is time span. It's important that we don't put time constraints on these transition phases. The time it takes someone to experience transition is very fluid and can change quickly. In Patty's case, her husband died last year. You can't put a time limit on this because it affects everyone differently. And being married 45 years to the same person really affects a person and a sense of identity. Lastly, critical points looks at the births and deaths and diagnosis of illness. As I mentioned before, Patty's critical points are with her husband's passing and her new diagnoses of end-stage renal disease, peripheral arterial disease, and her leg not healing. The next aspect looks at the conditions in which these transitions occur. The areas that are looked at are personal, community, and societal conditions. For Patty, her daughter takes her grocery shopping, but only once a month. She does have transportation set up for her through her insurance company to make sure she gets to and from dialysis. But other than that, she has no other support system in place. The next area looks at the patterns of response, which looks at the processes and outcomes. It looks at if the patient's engaged, if they're seeking and receiving support, are they acquiring confidence? If they are, then they're achieving mastery, they're fluid and integrative in their identity, they're resourceful, they have healthy interactions, and they perceive an overall sense of well-being. Patty's not engaged and does not seek support and is not confident in her transitions. A goal for interventions in this theory is to facilitate a healthy transition process and healthy outcome responses. This could include education, mobilizing support, providing resources. In Patty's case, offering support services such as referring her to her primary care for her depression and anxiety, and to get her up to date with her vaccines and screenings would be appropriate. Connecting her with a support group for widowed women may be beneficial to allow her to connect with others who are experiencing similar situations. Referring her to a dietitian is another option, so she can receive proper education on appropriate diet and foods that she should be consuming and or avoiding. We could have a home health nurse come out and perform wound care for her dressing changes, and also reaching out to her daughter to see if she could take Patty grocery shopping more than just once a month. And if that's not possible, then connecting her with a home care agency to have an aide maybe come out and take her grocery shopping once a week and help with any other needs that she has. The major goals of this theory are to prepare individuals and families for these transitions and to care for them during the transition to enhance their well-being and quality of life. The ultimate goal is so that they can cope with these changes they experience in their health and their environment and to function at their fullest capacity. That's it for today. I thank you for taking the time to be here and to listen to my presentation. If you have any questions, please feel free to ask, and have a great day.